Hey, what's up, everyone? It's Dr. Glenn Vo, and I am super excited to have this guest here. He is one of the founders of the Mod Institute. And before we get into this episode, I like to give a shout out to one of our premier sponsors, Get VWire. When you think about outsourcing front office duties, insurance duties, think Get VWire. We have a Nifty Thrifty deal with them, and they have been helping so many practices out in our community. Reach out to them, look at their website, and make sure you talk to Get VWire. It's Dr. Mike DeFee. Mike, what's up?
Hey, Glenn, it's great to be on here today. Despite the weather in Charleston being a little crazy, glad we could get on here and talk something about digital dentistry, which I'm super passionate about.
Yeah, well, Mike, thank you so much for jumping on. And guys, just to let you know, by the time you guys see this episode, the storm has already passed, but Mike and his family are getting the remnants of Hurricane Ian that just kind of ravaged through Florida, is going through South Carolina right now. But luckily for us, he's got power and everything's okay and he's safe. And so again, hey, the stars aligned, he's here. And I'm super excited because the first time I heard about Mike's Institute, someone who I am mentoring right now, her name's Alice Huang, and she was like, these guys are awesome. Like, you need to meet these dudes. They like changed my whole approach in dentistry. I'm like, hold up. And I was looking at it, I was like, are you talking about, it looks like it's called the MOD Institute. What are they? They're teaching you how to do better class twos or something? She's like, Glenn, please, no way. Okay, what these guys are doing are awesome. And so I reached out to Mike. I said, Mike, you got to jump on, man, because Alice said so many great things about you. I need to learn more. But Mike, let me just ask you this. How many times did people reach out to you and say, dude, the MOD Institute? Like, how? I can't be the only one who thinks that.
No, definitely not. It was actually an aside that I don't know, for whatever reason, we didn't really even consider it when we were naming the institute. Because we were thinking MOD stands for Modern Optimized Dentistry, which is the acronym there that really tries to encompass the philosophy that we teach and our approach to dentistry, which is really using the most up-to-date evidence in the literature to support how we practice and the treatments that we're recommending, and then leveraging digital technology to make it more efficient and more cost controlled for people who are running private offices. And so that's really what we're passionate about and what we teach. But yeah, it's funny because once we launched the institute, then I got tons of messages about that, and I was like, dang, we didn't even think about that.
Well, again, it's one of those things where it's like, hey, you want to make sure that you're not just sitting there just doing a bunch of class twos, because really, who really likes doing class twos? Now, what you guys actually teach is a lot more exciting. It's a lot more, it's just making dentistry fun, right? Leveling up, making things more efficient there. I just love just kind of like the principles behind the institute. But let's go back. Let's go back a little bit. Let's go back pre-institute. And let's talk about, Mike, your journey in this, right? Like, what brought you to the point where you wanted to create an institute, you and a partner, to really level up other people's digital game, but also get them excited about dentistry and the future of dentistry as well. Like, where did that all start? Like, how did your journey start?
Probably started a long time ago. So Dr. Renee and I went to dental school before together. He was a year ahead of me, and then I kind of branched out for some time outside of dental school, did some research training and a PhD, and then I went to private practice, and Dr. Renee stayed in education. We just really stayed in touch over the years, and he's been one of, I would say, the international pioneers for bringing digital dentistry to the forefront of how we practice. And I was integrating that into my private practice at the same time. And, had Dr. Renee had really had an idea for an institute like this that we had talked about for several years, and the stars kind of aligned, and we were like, the technology's there, we have the literature to support what we're doing. Like, now is the time to really jump in and help docs transform their practices, enjoy dentistry more, be more efficient, and be more profitable. And so that's when we just said, hey, let's jump in and make a go of this. And it's just been so much fun really to see docs just come alive with, that light bulb moment, which
Yeah.
not being in education, it was always something that Dr. Renee had talked about to me about all this is the most rewarding thing when you see someone have that kind of light bulb moment. And, it's a little hard to describe it and understand it when you're not, doing the education yourself, but it's been something that it's been super rewarding. And, I've just enjoyed it way more than I think I thought I could have, which is kind of crazy to say.
Yeah, well, I love the fact that you guys work really well together because you're blending kind of like private practice and private practice principles, but also realities of private practice, and you're blending that with just like the education and the research of academia, right? Like you kind of
Yeah.
brought those two things together, and I think that's so unique because a lot of times, and I'm going to be the first to admit this, right? You go through dental school and you're like, dude, like this is, dude, you couldn't hack it in private practice, and that's why you're here, right? Like I was one of those dudes, and I know there's a whole bunch of people out there, but again, it's not always the case. There's a passion for education. There's a passion to research and to keep leveling up, and so I love the fact that you guys are a good combination of that, of the very best of academia, of the very best of private practice, bringing that together because honestly, you can't get all the new procedures, you can't get all the new techniques, you can't do all those things without research, right? People always kind of think like, yeah, we got this new technique, and like, oh, these guys had, you can't get there without the research. You can't get there without the proof because, guys, we're not just we're doctors here, right? Everything we have to
Yeah.
do is evidence based. You just can't, like, your buddy just says, hey, I just did this, and that's how it is. You got to test it. So I just wanted to say that that's a cool kind of like melding of the two industries, right? Two places there. Is that kind of like the mindset there when you guys kind of created the institute?
Yeah, I mean, I think dentistry's been undergoing this evidence-based transition for quite some time, and I think Dr. Renee has a ton of publications. I've got about 15, and so yeah, that was
Oh,
really
just 15, right, Mike?
yeah,
Just 15. I mean, come on, man. That's a lot. How many does Dr. Renee have?
more than that. I don't know, a lot.
But that's a lot. That's a lot. I just wanted to point out that's already pretty impressive there.
Yeah, and so I think that's what we're really passionate about is driving that because we know that's going to improve our patient outcomes, improve our treatment predictability, which is less stress for everyone, which is always a better way to practice. And
Yeah.
so, that's why we're really passionate about blending the technology with the research to get the best outcomes for both sides of the equation. And so yeah, that really was the backbone of it and really what kind of drove our philosophy.
I love it. I love it. Now let's kind of take a deeper dive. So we understand the why behind the institute, right? We understand the why behind it. But now let's talk about what is the actual, how are things set up? Could you just kind of briefly go through, like, how is there different tracks? I'm assuming there's different tracks because when you think about digital dentistry, that's a lot of stuff, right? That's a
Yeah.
lot of stuff, and understanding that you guys are coming from not only from private practice but also from academia. I'm pretty sure that there's like a system, right? It's not like jump in here, here's a water hose, drink as fast as you can. Talk about how everything's set up. Is it tracks? Is it like, certain continuums? How's everything set up at that in the Mod Institute?
So one of the things that we're launching for next year, which we've just seen a lot of enthusiasm around, is a track-based system. And so next year we'll have three tracks. One track which will be focused on digital design, and that's really for docs who are super passionate about doing all their design or have an in-house lab or an assistant who's going to do a lot of their design. And so we'll be designing on exocad, where
Oh,
basically
okay.
we'll take you, class 1 is ultra intro, single unit crowns, single unit implant crowns, implant temporaries, all the way up to level 3 is doing dentures, removables, just really of the more complex things that you could do in design. And then we have an elective class where we'll also go into doing the final prosthetic design for Max as well, which is,
Oh,
kind of
wow.
outside of the track because it's applicable, I think, to a couple of the different tracks. But, you can literally take yourself from zero all the way up to what we
All
call a
on
digital
X.
master. Yeah.
Oh, wow. That's
Uh,
exciting.
the other track, which these are a couple new classes that we're launching for next year, is going to be what we're calling the digital occlusion track. And that is
Mm.
really blending evidence around occlusion, what principles we need to use in our everyday practice to make sure that we're setting up patients for pain-free, predictable restorations. The beginning of that is really the class 1 is really a lot about the philosophy. We go into some hands-on with splint designs, what's the most appropriate time to use the different splints, because that's one of the things that the docs can really bring into their practice, and it can be ultra profitable. And the ability to design and print out a splint the same day for your patient or the day after, like, it's just it's profitable, it's easy, and patients love that quick turnaround, so we're not waiting 3 weeks to get something back from lab.
People want things like yesterday, right?
Yep.
I mean, we see it in everything. I mean, think about like the whole Amazon phenomena, right? Like
Yeah.
like basically your purchasing decision is based on if it's Prime, right? Oh, it's not
Exactly.
Amazon Prime. I'm not buying it. I don't care. I'm just gonna buy this other thing. So I love
Yeah.
that idea, and I love the fact that that you guys are weaving in occlusion, because let's be honest here, you got to make sure the occlusion's dialed in if you want your restorations to last, right? You don't want
Yep.
to, I mean, and that is stress. Again, you were
Yes.
talking about how a big thing is reduce stress, right? Can you imagine what's more stressful than you just did all these restorations and you're fixing it after a year because they're just breaking and you're just pulling your hair out. So I love that. So there's a occlusion track. I think you were saying there's a design track. What else is there? What
Well,
about the
let me hit
actual?
the other two classes in the
Oh, okay,
inclusion
okay,
track are something I'm super passionate about,
yeah.
and what I do a lot of, and that's really a predictable way to do full mouth restorative using digital that we know works. It's all completely replicable, so that we're using the technology to go in and, I mean, we do our full mouth restoratives upper and lower. We'll prep both arches the same day. We'll print temps that fit directly onto that. We teach you how to do that so that you've digitally dialed in your occlusion. You're delivering temporaries that perfectly match that in a very time efficient, low stress way. Because I know when I was doing all of that analog, one of the things that I dreaded the most was getting done with all my preps and then having to make the temporaries.
Oh my gosh, yes, yeah. Me too. Me.
And then the third class is really how to copy mill and transfer all the occlusion and the things that you've worked out in the patient's mouth to your final prosthetic in an ultra predictable way. And so that is something I'm just super excited about. And I know that when I first started doing those types of big restorative cases, I made a lot of mistakes and struggled quite a lot. And being able to work those out and make them a lot lower stress using the digital tools is just something I'm super excited to be a part of teaching and to help docs bring into their practice. So that's the occlusion track. The third track is the printing track, is
Oh,
completely focused on 3D printing. We do a little bit of design there just based on, understanding the principles and the records that you need to send to your lab if you're not going to be doing your own design. I think that's super helpful. But what we've also seen with, doing a little bit of introduction design is docs get super excited and passionate about that. And then they're like, oh, I need to bring this in-house.
yeah, yeah,
Um,
yeah.
and
So
so the 3D,
I love the fact that all the tracks, they kind of feed into each other and work with each other. Is there a certain sequence that you would recommend for those who might be interested to going through these tracks? Is there a sequence, as in, like, should you do this track first? Should you go through a entire track before jumping on? Can you kind of go back and forth? What is your recommendations for those who are kind of interested in what you're saying and want to dive in.
I think the where I usually recommend people start is find what you're passionate about. Like, what do you really love to do in your practice, and start there. And if it's printing, and then start there. And if you're really into occlusion and you want to learn to do big restorative cases, or maybe you're doing them and you really want to find a way to make them more efficient and more profitable and lower stress for yourself, then start with the occlusion track. And, if you're a computer nerd, kind of like I am, and you want to start with the design, then start with design. Design will take you just to the most advanced. You will be able to do everything in office that you want to do using the power of exocad. So I think that's always the best place to start. And there is, it's like you mentioned, there's certainly some overlap there, but it's to tease people and kind of help them understand, hey, maybe you're learning a little bit about this and you really love it. Then we have classes where we really deep dive into those things specifically as well. And so, but that's what I would say. Start with a topic you're interested in or passionate about, because I love all the tracks. Obviously, I'm a little bit biased, but I think they all bring unique sets of value for docs. And we know that you're going to be the best at what you love to do. So that's a long-winded way, I guess, of
Well, I
that.
love that philosophy because again, and it's not as rigid. There's just so many different great programs out there, but there's certain programs where they kind of force you into this like little pathway and they make you go there, jump through these hoops before you get to what you like. I love the fact that you guys are leading with, hey, let's start with what you like. And as you go through what you like, you're going to realize that you kind of like these other things too. You kind of go over there too. So I love that philosophy. Now, look, so Mike, we're going to switch gears here. We're going to switch gears here. And again, we understand the why. We understand now what is the institute, what are the modes of learning and the different tracks and whatnot. Now I kind of want to talk about the actual attendees, the actual doctors who've gone through your program. And we don't have to share any names, but let's just talk about their particular the results and also their background. Talk about like what are some of the like these fulfilling, these really rewarding situations that you were used to when you were working different docs and the light bulb went on. Talk about some of the changes that happened to them as clinicians and as practice owners. Share some of those stories that you experience with these great changes with these docs that came through.
Yeah, I mean, a couple really kind of stick out in mind, and we have docs from the very beginning of their careers all the way up to, docs who've been practicing for 30 or 40 years
Yeah.
and really kind of trying to rediscover some passion in dentistry, because, they're great at what they do, but we know we're mostly guys, guys and girls who love to learn and be challenged.
Yeah.
And making that step, I think, one of the probably the most rewarding, and this has happened several times, that
Yeah.
I just really love is, digital is finally getting to the point where adoption has crossed the tipping point. And we know that the technology really has been there for quite some time, but there was a lot of resistance for different reasons. And at our most recent class, which was a digital removables class, where we go through kind of the design for dentures and partials. If you're printing them in office, like how do you finish them? How do you make them look beautiful? And was spend quite a bit of time with an older doc he's slowly kind of transitioning his career. He's got a daughter who's going to come and work with him, who's finishing dental school, and he's looking for that next challenge. Right. And, adopting digital, and I will say this on the front end, jumping straight into the removals class is ultra advanced. So I wouldn't recommend that for everyone who doesn't have a lot of, digital design or digital experience. But, to really spend some time with him and see him so passionate about how he's going to take this back to the office, and how, he can do this design, and his assistant can do this, and it's going to change just the way they're able to deliver dentures, and the results they're going to be able to get for their patients. It was just, that's that kind of light bulb, really rewarding moment, because doing, I think dentures is probably one of the most transformative things that we can bring into our offices digitally. You know, we teach a workflow where you can take all your denture records in one appointment that is a little bit over an hour.
Wow.
And, you know, if you're doing your own design, you can literally sit down and do your design and print your denture the same day and deliver it the very next day. And that is just something that has not been reality for denture workflows for quite some time. You know, we all know the frustrations of a 4 to 6 week
Yeah.
lead time of getting a denture made back. And so that was what this doctor specifically was just communicating to me, to what he was really passionate about, and being able to bring that into his office.
And this doctor was been practicing for how long? Like approximately?
He was in his late 60s, so 40-ish years, I guess.
Wow. And just going through this, someone who's practiced, and that's so important to hear because there's different doctors at different levels of experience, but also practice time. But someone who has probably done dentures a certain way for, I can safely say at least 20 years, right?
Yeah,
Probably at least 20 years, right? If they've been practicing for 40 years, they've probably been doing dentures the way they've been doing it for at least 20 years. And for them to say, "Oh my gosh, there's a new way of doing it," and then getting excited about it too. I love that story. And would I say, Mike, would that be safe to say that those type of experiences is what really makes you excited about providing the education you guys provide?
yeah, yeah, absolutely. Is just, you know, is giving people passionate about what they're going to be able to do for their patients, I think is what really drives me, man. And yeah, I mean, you know, you just think about how great this is going to be for that doctor, but how great this is going to be for his patients.
Oh yeah, of
And
course.
yeah, I just I really love that.
So Mike, I'm gonna give you a hard question now, right? I'm gonna give you a hard question. Okay. This has nothing to do, well, it does a little bit about the institute and about your practicing and whatnot, but I'm just gonna ask you this. Are you optimistic or pessimistic about the future of dentistry?
I mean, I don't know how you would ever be pessimistic about dentistry, especially right now, and
Yeah.
especially with how technology is just transforming the way we can practice and what we can deliver for our patients. It is just an amazing time to be practicing dentistry, to have all these advances in printed materials, in milled materials, in software, in AI that'll simplify our designs. It's just, oh man, it's hard to think about practicing in the 80s and before all of this.
Oh man,
But
I love
I
it.
think it's just a great time to be a doctor. And, you know,
Yeah.
I mean, certainly there's challenges, right? But there's always going to be challenges, and challenges really are opportunities for us to get better and, you know, deliver a better, you know, kind of product and better results for our patients.
I love it. I love it. And with that being said, for those who are watching this and who are listening to it as well, you're probably thinking like, all right, well, I want to learn more about the Mod Institute. I want to get that same kind of excitement. I want to get excited about dentistry. I want to take my dental skills to another level. I want to keep on getting better. And so they want to know about the Mod Institute, right? So Mike, what's the best way to learn more and to kind of start the journey with this digital dentistry journey, or continue it for some people?
Well, you could connect with us on Instagram. We're really active in, you know, posting cases and little educational snippets on there. So we're at the Mod Institute. You can also find us at themodinstitute.com, which is where, you know, all our courses and tracks are listed for rest of this year and next year. We have a lot of free resources there, printable and printable pieces that we've designed and released out just because to have people be able to practice better. We've got a deprogramming jig that you can download and print
Oh,
on your
nice.
printer. We've got retractors. We've got the denture tray that we use for records. We've got a downloadable exocad library, just lots of cool things to kind of jump in and piddle with, along with some, you know, kind of introductory tutorials on different smile designs and things to help you kind of understand if this digital journey is something that I'm ready to go on. And then our tracks. I mean, we really have set the tracks up for next year to start, total beginner and then work your way up to a master. So if you haven't done digital dentistry, or maybe you're doing a little bit and really want to be more efficient, yeah, check out our tracks, find, which one seems like it fits your passions the most. And we'd love to see you in Charleston for a course either end of this year or next year.
I love it. Mike, thank you so much for jumping on. Guys, we'll have all the information in the show notes. And if you're watching this on social media, we'll have it in the comments as well. Mike, thank you so much for jumping on. And guys, we'll see y'all next time.
See ya.